I'm Sarah Ryan. I'm a PT here at One Settler Physical Therapy, and today I'm going to be talking about fall recovery. So first, if you were to fall, we're going to start with what to do when you're on the ground and how to get up in safe ways, okay? And so if you get down on the ground and you have fallen, first you want to make sure that everything's okay. So you kind of want to wiggle around, make sure hands okay, head's okay, legs are good. After that and everything feels fine, what you want to do is bring one leg up. I'm going to bring my right leg up. Let's do left leg actually, and then you're going to roll to the side. And then once you feel like everything's okay, once you roll to the side, you're not dizzy or anything, you want to bring your hand over and help push yourself up onto your elbow. Make sure you're not dizzy or anything. Once you get there, you can kind of climb up onto hands and knees if you can. And then the next thing you want to do is bring your strong leg forward. For me, it's my right leg. I'm going to bring my right leg forward. Make sure I'm nice and balanced. You can use your hands on your leg, push to stand up. So the next one is going to be using an object to stand up on if you have something like a couch or a chair. So as previously said, if you're on the ground, you want to check and make sure everything's okay. You want to bend one knee up, roll to the side, sit up. You're going to get into that same hands and knees position. And then you still want to drive your strong leg forward. For me, it's my right. You can use your left. This time I'll do my left just for difference sakes. Hand on something stable. You can use both hands or one hand here, push, stand up, bring that foot forward, and come up. Okay, so the next technique is going to be a tilt technique. So this is as if we've gotten onto our hands and knees and you have something pretty stable by you, like a couch, where it's something where you can kind of push up against the couch where it's stable, you're going to lean onto it, it's not going to tip or fall backwards. So this technique, you want to kind of get onto your butt from your hands and knees, reach your elbows back if you can, use your feet to help bridge yourself up, arms are helping you as well, and you want to kind of wiggle back onto that couch or chair and then sit up onto it. This next one is a caveat to the last one that I just showed. So this is if you don't really have the shoulder range of motion to get up onto a box or up onto your couch. If you have something like a couch cushion or books or something like a big pillow that you can kind of scoot up on to help raise your butt up a little bit more, you could crawl over to that, come over onto your butt, either come up onto that cushion or book and try to shift yourself up onto that, scoot back a little bit, and it's just breaking it into 2 steps. Then getting here so that your arms aren't having to come up as high, and then same thing, tilting back, bridging up, sliding, and then sitting up. So this last one is a technique that was actually shown to us by a couple of patients who have trouble with their knees and their hips. So this is a really good technique if you have pain or trouble getting onto your knees, but you still have that hamstring flexibility that allows you to do this. So if you don't want to get onto hands and knees for a long period of time, you can kind of shift onto them and shift into your hands. You do have to have a stronger upper body for this technique, but kind of shifting forward here and walking yourself